All right, today we're going to be medical detectives. We're diving into a mystery that often starts with just one single, pretty alarming sign. Our job? To follow the clues one by one to figure out what's really going on inside the body. So imagine this. A person just starts noticing their abdomen getting bigger and bigger. Maybe they're gaining weight all of a sudden, or even feel short of breath. This isn't just feeling a little bloated after a big meal. It's different. It's significant. And that's the central question that kicks off our entire investigation. Now, this unexplained swelling has a name. It's called ascites. And right here, this is the first and maybe the most crucial piece of the puzzle. Ascites itself isn't the disease. Think of it like a big flashing warning light. It's a signal that something else, something bigger, is going on. And our job is to find out what that is. So let's get our investigation started. We have our first major clue. We know there's fluid where it shouldn't be. So how do we start to narrow down the list of suspects? Well, the first step is a physical exam. You can think of it like a detective surveying the scene for the first time. The doctor's looking for the obvious stuff, right? A bigger belly, weight gain. They also have this cool technique where they tap on the abdomen. They're listening for something called shifting dullness, which is a big tip-off that there's fluid sloshing around. And they're looking for other clues, like jaundice, which might point a finger directly at the liver. The physical exam gives us a really strong suspicion, but suspicions aren't enough in medicine. We need hard evidence. So this is where the real diagnostic work begins, as we follow these clues to get a much clearer picture. The whole process follows a really clear, logical path. We've done step one, the physical exam. Next, we need to get our eyes on the inside with an ultrasound. And then, the final and most revealing step of all, we're going to analyze the fluid itself. An ultrasound is just fantastic for this. It can spot even tiny amounts of fluid, so it confirms what we suspect with total certainty. Plus, it gives us a first peek at the liver and the other organs in there. So now we know, for sure, there's fluid. But the big question remains, what is that fluid and where did it come from? And this is where the mystery really starts to crack wide open. The ultrasound confirms the what, that there's fluid, but it's analyzing a sample of that fluid from a procedure called a paracentesis that's going to tell us the why. Okay, what's so cool about this next part is that it all comes down to a single clue. One simple calculation that literally changes the entire direction of the case. It's a total turning point. It's called the SAG. That stands for serum ascites albumin gradient. I know, it sounds super complicated, but the idea is actually incredibly simple. We just measure the amount of a protein, albumin, in the person's blood. Then we measure the albumin in that fluid we took from their abdomen. The difference between those two numbers, that's a SAG. And this little number is so powerful. This is it. This is the magic number, 1.1. Whether the SAG is above this number or below it tells us almost everything we need to know. It sends our investigation down one of two completely different paths. So, here's the fork in the road. If the SAG is high, 1.1 or more, it points with about 97% accuracy to something called portal hypertension. That's basically high blood pressure in the veins that feed the liver. But if the SAG is low, we start looking for a whole different set of culprits, like certain infections or cancers. Now, have a look at this. About 85%, the vast majority, of all ascites cases fall into that high SAG bucket. So, for the rest of our time here, we're just going to follow the evidence and focus on the most common scenario, a high SAG. Okay, so we've narrowed it down a ton. We know the fluid is caused by this portal hypertension, but what's causing that pressure to build up in the first place? Let's unmask the main suspect. And boom! This chart just lays it all out for us. While a few other things can cause it, like heart failure, a staggering 80% of the time, the root cause of portal hypertension and high SAG ascites is liver cirrhosis. That's when the liver becomes hardened and scarred. So how in the world does a scarred liver make the abdomen fill up with fluid? Well, the best way to picture it is like a plumbing backup. That scarred, hard liver creates a kind of blockage in the main vein. Blood can't flow through it easily. So the body gets confused. It misreads this traffic jam as a sign of dehydration, and it panics, flipping on all its emergency systems. It tells the kidneys, hold on to all the salt and water you can. But because the plumbing is still blocked, all that extra fluid has nowhere to go, so it just overflows and leaks right out into the abdomen. So now that we've ID'd the cause, we can switch gears and talk about the action plan. How do we actually manage this fluid and get the person some relief? The whole strategy is built on a few key pillars. First, and this is the absolute cornerstone of treatment, is a major cutback on sodium, because wherever salt goes, water is sure to follow. Next up are diuretics. You might know them as water pills, to help the kidneys finally get rid of all that extra salt and water. Patients also have to weigh themselves every single day to track how things are going. And of course, and this is a huge one, if alcohol caused the cirrhosis, stopping drinking is completely non-negotiable. Now, when it comes to those diuretic meds, doctors often use this specific 1-2 punch. Spironolactone is the main player here. Then furosemide is added to help it out. And what's really fascinating is that they work best when they're kept at this very specific 100 to 40 milligram ratio. But what if the fluid buildup is just awful? So much that it's painful or making it hard to breathe? Well, in those cases, that same procedure we use to get a sample, the paracentesis, can be used for treatment. A doctor can literally drain 5, 6, even more liters of fluid right out of the abdomen. The relief is immediate, and it can be pretty dramatic. So, we've figured out the cause and we have a solid plan to manage the fluid. But it is so important to step back for a second and remember the bigger picture here. And this quote just says it all perfectly. The diuretics, the low salt diet, all of those things are tools to control the symptom. And they are incredibly important for helping someone feel better. But the real fight, the ultimate goal, is always, always about treating the underlying liver disease that kicked off this whole chain reaction in the first place. So let's just quickly recap the key clues from our investigation. Number 1, ascites is just a signal, not the actual disease. Number 2, that SAAG calculation is the master key that unlocks the whole diagnosis. And number 3, most of the time, that key points straight to portal hypertension, which is caused by liver cirrhosis. We started this whole journey with one symptom, a swollen abdomen, and we treated it like a clue in a mystery. It's a great reminder that so often, the things we can see on the outside are just the very beginning of the story. The real question we should always be asking is, what is your body trying to tell you?